This is the mediastinum. The superior mediastinum extends from the thoracic inlet down to the level of the sternal angle, and from the manubrium anteriorly to the upper four thoracic vertebrae posteriorly. So the whole region above the heart is the superior mediastinum. It contains blood vessels, the trachea, the esophagus, nerves and lymph nodes. The part of the mediastinum below the sternal angle is divided into the anterior mediastinum, which lies in front of the heart, the middle mediastinum, which is occupied by the heart and pericardium, and the posterior mediastinum, which is the part behind the heart and the pericardium. Right side of mediastinum. The root of the lung and the arch of the azygous vein form the key to this service. This is the root of the right lung. It is formed of the principal bronchus posteriorly, the pulmonary artery just in front of the bronchus, and the two pulmonary veins. The superior vein is in front of the artery, and the inferior vein is below the bronchus. The rest of the lung enters the hilum of the lung. The root of the lung enters the hilum of the lung. This is the arch of the azygous vein, arching over the root of the lung to end in the middle of the superior vena cava. The azygous vein is seen passing on the posterior chest wall behind the heart and the esophagus. It receives the posterior intercostal veins of the right side. This is the superior vena cava. It begins by the union of the right and left brachiocephalic veins and ends by opening into the right atrium after piercing the pericardium. It is joined by the azygous vein. Notice the phrenic nerve as it descends on the surface of the right brachiocephalic vein, the superior vena cava, the pericardium covering the right atrium, and below on the inferior vena cava. It is accompanied by the pericardico-phrenic artery, which arises from the lateral thoracic artery. This is the right atrium. It forms the whole right side of the heart. This is the inferior vena cava, which is a very short segment inside the chest. That is to say, after it pierces the diaphragm. This is the trachea. Lying above the arch of the azygous vein, with the vagus nerve on its side, and the esophagus lies behind it. The vagus nerve runs downwards and backwards deep to the arch of the azygous vein to come behind the root of the lung. then continues to the esophagus. Compare this course with that of the phrenic nerve, which runs in front of the root of the lung. This is the esophagus, lying behind the trachea. It is overlapped on its right side by the arch of the azygous vein, then continues downwards and to the left of the midline to come on the right side of the descending aorta, then crosses in front of it to come on its left side. This is the sympathetic chain. And this is the greater splanchnic nerve. Now it is better to see the impressions of the right side of mediastinum on the right lung. This is the mediastinal surface of the right lung. This is the hilum of the lung, showing the structures of the root of the lung cut in section. This is the principal bronchus, most posteriorly, and is hard when fed due to the presence of plates of cartilage in its wall. This is the pulmonary artery, just in front of the bronchus. This is the eparterial bronchus, which lies just above the pulmonary artery. This is the superior pulmonary vein in front of the artery. It is the most anterior. This is the inferior pulmonary vein below the principal bronchus. It is the most inferior. The pulmonary ligament is a fold of pulmonary pleura that extends below the hilum. This white membrane is the pulmonary or visceral pleura. To identify the structures in the hilum, start with the most posterior opening, which is the bronchus. Then the most anterior is the superior pulmonary vein, and the artery is in between. The most lower is the inferior pulmonary vein. This is the groove for the arch of the azygous vein, just above the hilum. This vertical groove is for the right brachiocephalic vein and the superior vena cava. The area above the arch of the azygos is related to the trachea and esophagus. The trachea is in front of the esophagus. The area in front and below the hilum is for the right atrium. The area in front of the superior vena cava is for the upper end of the ascending aorta. The inferior vena cava forms a notch on the inferior border of and in line with the superior vena cava. The area behind the hilum is related to the azygous vein and the esophagus. The esophagus is in front of the azygous vein.